Hello everyone, thank you for joining us. Today's Cancer Care Winter Seminar topic is Samaritan Local Cancer, it's Sun Safety and Skin Cancer Prevention. My name is Carmen Boone. I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. This presentation is being recorded. All microphones are muted and will remain muted during this session. Please use the questions menu to type your questions and comments at any time. Time is reserved at the end of the session for questions and answers. Send us an email if you would like a copy of the slides at the end of the webinar. Joining us today is Dr. Adriana Brune, dermatologist at Brune Dermatology in Corvallis. Thank you so much for being here with us, Dr. Brune. I will go ahead and pass the presentation over to you right now.
Thank you, Carmen. Thank you very much. Today, I'm going to be presenting on sun safety and skin cancer prevention. I am a board-certified dermatologist in Corvallis. So we all love the sun, and we know that the sun is life. But my job today is to let you know about the not so good face of the sun and all the injuries that it can cause on our skin. Some statistics, 1 in 5 Americans will develop skin cancer in their lifetime. There are many different types of skin cancers, and I'm going to show you some more slides on that in a little bit. Which one will it be? Could it be a Caucasian person? Could it be a young person? Could it be an old person? Could it be an African-American person? Yes, it can be anyone. Skin cancer is actually the most common cancer in the United States. So the sun emits several ultraviolet lights or rays. The two most common that do penetrate the atmosphere are ultraviolet B rays, which are short wavelength rays, and they are responsible for our sunburn on our skin. The UVA rays are longer in wavelength. They penetrate deeper into our skin, and not only they are responsible for wrinkles and aging of our skin, but also skin cancers. So both rays are responsible for skin cancers. But at the same time, like I said before, the UVB rays are short. They typically will produce a sunburn. They're not in very high levels during the winter time, only in the summertime. And they don't penetrate clothing, and they don't penetrate clouds or windows in general. The UVA rays, on the other hand, being longer wavelength, they do penetrate light clothing, and they do penetrate the clouds. And they are responsible for all the aging. These are the rays that you cannot feel. They're not that warm like the UVB rays. So therefore, this is the common rays that you get every single day when you're driving, when you're walking your dog. Even if it's nice and cool, you don't feel them. And unfortunately, they are relentless. You still get UVA rays even in the wintertime. So what are the effects of the sun on our skin? Well, the number one will be a sunburn, as you can see on the picture on the left side. Those are typically most likely induced in the great majority by the UVB rays. Sun allergy. What is sun allergy, or photoallergy also called? So sun allergy develops in people who basically have a predisposition to develop that, or they are taking medications that make them to become sensitive or allergic to the sun. There are several medications that can cause that, by the way. Some of them are high blood pressure medications and antibiotics, and there are other ones. And you can see on the left lower side of the screen, there is a typical rash that looks like eczema. This is how sun allergy looks like. You typically will go out, even if you're just walking, and then you develop this very itchy rash. It almost feels like poison oak, and that is photoallergy or photoallergic rash. What's photosensitivity? So it's people who don't have an allergy to the sun, but they are sensitive to the sun, and they can develop a sunburn very, very easily. So those will be people who are on certain medications, such as sulfa antibiotics, the thiazide, high blood pressure medications, and others. So the sun can also produce premature aging of the skin. You can see it on the photo on the right side of the slide. You can see this aging skin of this man is on the left side of the face, is more than on the right, because that's his driving side. So you can see there is a loss of collagen or loss of meat, if you want. You can see almost the hollow cheeks, and you see all the wrinkles. The skin becomes droopy. All that is not only induced by aging, but it's in a great amount is produced by sun. Also, you can see sunspots on the upper right-hand side. Those are sunspots induced by the sun, also age spots induced by the sun. People call them liver spots. They are ugly. They don't turn into cancer. They're benign. They're just ugly. They are cosmetic nuisances. You can also see the tendons in this not so old woman who unfortunately had a lot of sun damage, a lot of sun exposure throughout her life, and you can actually see the thinning of the skin of the hands. And then skin cancer, as you can see on the bottom part, there are different types of skin cancer. You can see melanoma on the right-hand side, and other skin cancers, non-melanoma skin cancers, such as a squamous cell, that I'm going to touch bases on in a little bit. And then there are other problems that the sun can produce on our body, such as cataracts in the eyes and immune suppression. So why are skin cancer rates rising? Well, when we look at the 1980s, 1970s until now, a lot of things have changed. First of all, there is more of a social acceptability of a tan, less clothing that are being worn, and more leisure times. There is a depletion of ozone layer. Tanning bed use is on the rise since the 60s. And there is an earlier sun damage. 1 out of 13 high school girls are tanning in tan booths. So it's a combination of all of these. So where do skin cancers come from? So there are 3 most common skin cancers, but there are many more, of course, but these are the most common. Squamous cells. So the first skin cancer I'm going to touch bases on is on the upper part of our skin layer called epidermis. There are these cuboidal cells called squamous cells, and those will, when they get their DNA or their genetic, information messed up from the sun damage, then they become squamous cell skin cancer. The basal cells are located at the base of the epidermis. Again, that is the uppermost layer of the skin. And they induce the cancer called basal cell, as you can see in that figure. The third and the most lethal skin cancer type is melanoma. It comes from melanocytes. Melanocytes are the pigment-producing cells that are at the base of our uppermost layer of the skin, called epidermis, and they are kind of intermingled among the basal cells. So these 3 cells have a completely different origin. They look completely different, and these cancers do not turn into each other. So if you have a squamous cell, it will always be a squamous cell. If you have a basal cell, it will never turn into a melanoma, and vice versa. So the 3 major types of skin cancer, as I said before, melanoma, basal cell carcinoma, and squamous cell carcinoma, with melanoma being the least common, but the most deadly. Melanoma occurs at all ages, but half of the amount of melanomas occur after the age of 50. It is the second most common cancer in people ages 15 to 29, which is alarming. The mortality rate of melanomas is higher the older you are. So an 80 years old with a melanoma has a higher risk of dying from a melanoma than a 15-year-old. So what about people of color? Skin cancer is colorblind. It affects all skin races. As you can see, there is a melanoma on a Hispanic girl on the left-hand side, on the lip, a common area for a lot of sun exposure. And it's an area that sometimes, especially people who are darker in skin color, they tend to forget to reapply their sunscreen. You have a squamous cell carcinoma there on the hand of also a darker skin person, a basal cell on the right upper corner on also a Hispanic person, and an African American with a basal cell, a very large basal cell on the left side of the face, on the ear, and that is his driver's side. So basal cells, so these three cancers look different. Nonetheless, basal cells and melanomas sometimes look very similar, especially when basal cells tend to have pigments like brown coloration inside them, the bumps. So this is a typical look for a basal cell. They look pink or red, they look pearly, so they're shiny, and they have these big, large veins that you can see. Sometimes they'll have these globs of pigment, which are dark balls inside. Basal cell is the least deadly of all skin cancers. And it's by far the most common skin cancer, and it's by far the most common cancer in all people in the United States. They typically will arrive or will come on areas of sun exposure, so typically the face, the neck, the ears, the scalp, especially in bald men or bald women. It appears, it likes the hands, the arms, the neck, the chest, the upper back, the lower legs. So those are areas of more sun exposure. I said that this is the least deadly of all the skin cancers. Less than 1% of them will actually go to other parts of your body. The treatment for this skin cancer is actually pretty easy. They have to be removed with surgery. And sometimes, depending on the type of basal cells they are, sometimes we treat with other modalities. Squamous cell is the second one, a little more problematic. It has a higher chance for going into the lymph nodes and other parts of the body, such as the lungs, the brain. This one, especially if they are located on the ear, much more common in men than in women. They can not only come from the sun, but also from warts, especially on sun-exposed areas, such as the lower legs and around the fingers. When it comes from warts, it's typically on a person who is either pretty old, has had a lot of sun exposure, or is an immunocompromised person, such as transplant patients, patients who are on immunosuppressants for transplants, organ transplant, will develop this skin cancer much more common than any other skin cancer, especially on areas of sun exposure, such as you can see the forehead, the face, the upper back, the ears, the temple. Those are one of the temples and ears are one of the worst places to have a squamous cell, because they do tend to have a higher risk for metastases or going to other places. Then we have melanoma. So I am showing you some photos of typical melanomas. You can see, and we're going to touch bases a little bit more on that, but you can see how all these images have in common that they tend to be large, they have different colors, they have borders that are a little bit irregular. But what about the darker skin people? Darker skin people, unfortunately, will have melanomas in areas of not so much sun damage. And by the time that they are caught, they are unfortunately usually in higher stages. If you look at this subungual melanoma, like under the nail, there is typically one nail that is affected. Many people will have, especially people of darker skin color, will have colors like pigment on different nails. Sometimes they will have it on all their nails. They have like lines that are darker, and that is okay. But when you have something like this that is large, it has different colors, if you can tell, it's darker on the left side and on the right side, is irregular, it's asymmetrical. So if you cut that image in half, you're going to see that the two halves of the pigmented part are different. And it's only one nail that is affected. That is not a very good thing. So we encourage people of darker skin color to check their nails, check their palms and soles as well, because they tend to have a hidden melanoma. And by the time that they are discovered, unfortunately, it's too late for treatment. So 1 American dies from melanoma every hour, and that is alarming. It's the second most common cancer in adolescents and young adults aged 15 to 29, and that is very alarming. Also, 2.3% of skin cancers are melanomas, but the majority of death due to skin cancers are from melanoma. And these are good statistics. So how can we identify melanoma? And I have to say that melanomas and in general skin cancers are the most, the cancers that you can spot with your eyes. So if you spot something that is changing or something that doesn't look right, you can cure that skin cancer with your eyes. It's the only cancer that you can do that with. So the ABCDs of melanoma: A for asymmetry. That means that if you cut or if you mark a line in the middle of the lesion, both sides would be completely different. That's called asymmetry. If the lesion has irregular borders, color variation, if it has more than 1 or 2 colors. D for diameter, if they are larger than 6 millimeters or larger than a pencil eraser. And the most important is change. So if you have, say, a normal mole looking like the ones on the upper part, and then they change into the ones on the bottom, that is called evolution. So let's look into this ABCDE a little bit more in depth. Asymmetry, as I said before, you can see that moles on the upper part are benign. If you cut them in half, both halves are the same or look very similar. B for border, again, those benign moles on top have pretty good borders, and the borders on the ones, the abnormal moles down at the bottom, which are melanomas, they'll have irregular borders. Their borders are jagged and uneven. They're sometimes poorly defined. Color. If the mole has 1 color or 2 colors, but it has not been changing in years, it's most likely an okay benign mole. But when the color is changing, when it's uneven, or it has multiple colors, especially if it has all those colors, as you can see on the left, then it's most likely a melanoma. Diameter, so bigger than a pencil eraser, which is typically around 5 millimeters. So if it is bigger than 5 millimeters, then you have to be a little bit more concerned. And the other important signs, just say you have a mole like the one on the left side, and it's starting to change, and all of a sudden it changes into the one on the right, that's a melanoma, and that's called evolution. Or also, if you have a mole that you have had for a while, but all of a sudden it starts to bleed for no reason, or is itching, please go see a dermatologist, because it could be a melanoma. The other part is the ugly duckling sign. This is just as important as the other signs. So you may have a mole that it looks very different than the other moles on your body, even if it doesn't have all those ABCDEs. So that is a mole that either you have to watch or you basically want to see a dermatologist for it. So as you can see, all the damages that this young person has. She's young and she looks very old because of all the tanning that she has had for many years. So I just wanted to put this slide there for a little bit of a smile on your faces. Select the skin cancer, basal cells, squamous, melanomas. So what we do know is that back in the 2010, the skin cancers have been linked to UV radiation, either from the sun or from tanning beds. Unfortunately, tanning beds back in 2013 has been linked directly to DNA mutation inducing melanoma. And that is a fact. Nobody can refute that. So what are the risk factors for skin cancer? Well, number one will be sun exposure. So a lot of people ask me, well, yeah, but you know, if I just go for 15 minutes every day, if I take it for my vitamin D, it should be fine. Well, I'm not sure that I can say it's fine. It might be fine for a person who is maybe for an African American in New York in the wintertime. But what about a person who is very fair, as that's your second risk factor, that is very fair, redhead or not, and maybe 15 minutes but lives in the equator, or you know, it's taking the 15 minutes during the hours of, let's say, at 1 p.m. in the summertime. So it's not the same. Do you understand? It's like, okay, and also taking, doing sun exposure for vitamin D production is not safe. Nobody can tell you, yes, it's totally safe. And nobody will tell you, yes, it's enough. It may not be enough. The amount of exposure to the sun that you are doing may not be enough for vitamin D, yet you are predisposing your skin, not only to to skin cancer, but also to developing premature aging of your skin. What about family history of skin cancer, specifically for melanoma? That's more specific for melanoma, yes. And some melanomas, I have to say, like I mentioned before, will come on areas where you have not had sun exposure or significant sun exposure. People who have more than 50 moles, or people who have had atypical moles, so people who have a lot of moles that look very, very weird. They have moles that look small, moles that look really large, moles that have irregular colors, that change all the time, or that have irregular borders, such as the person depicted in the picture. And also if a person has had any previous history of melanoma, but not only melanoma, also a person who has had previous history of either any kind of precancerous lesions or history of a previous skin cancer, even a non-melanoma skin cancer. Those people are at higher risk for developing any other skin cancer. So when is the sun most intense? In the middle of the day, between the hours of 10 a.m. and 4 p.m., during the summer months, at higher altitudes, in regions of the Earth closer to the equator. And when the ultraviolet rays can penetrate more than 3 feet of water. Let's don't forget that. This is something that most divers will forget about, and people who like the water and outdoor sports forget about. So what about sun protection? Well, nothing works 100%. So there is no sunscreen that will protect you 100% at all times. So the best is to have a combination of sun protection. Number one, cover it up. How? Well, love your rash guard. There are some rash guards that are beautiful. They're long sleeves and they don't let the sun penetrate. Play in the shade. Have your little one play in the shade. Make sure you cover them with a nice little hat with a brim. Make sure that you give them the long sleeve rash guards and keep them in the shade. Keep them under an umbrella or a tent. know your sunscreen. We're gonna take a little, an extra moment talking about sunscreens in the following slides anyway. What does UPF or SPF mean? So SPF, or sun protecting factor, means basically it's numbers. So you can have sun protecting factors beyond the number 15, which can be appropriate for the winter time, but for the summertime and in general, we suggest a 30 and above. But what is important to know is that when you apply and how to apply your sunscreen. So I'm going to talk about that a little bit in the next few slides. And then finally, say no to tanning beds. One mistake that people make is to go to a tanning bed to prep their skin before they go to the beach when they go on vacation. They feel like, oh, but it is safe to go and have a few tans, a few sessions of tanning bed so I don't sunburn, thinking that sunburning is the only reason why you can develop aging skin and skin cancer, and that's wrong. So anytime your skin is tan, then already has DNA damage. That's just the way it is. So what to wear to protect your skin? So if a person gets sunburn, it's because they didn't use enough sunscreen, or they didn't reapply it after being in the sun, or they used an expired product. So first of all, make sure that you choose a product that it hasn't been expired. So yes, sunscreens do have an expiration, and it will be noted on the bottle. To help protect your skin from the sun, you have to wear clothing too. And accessories such as a hat, is sunshades. You need sunglasses with UV protection. That's very important to prevent damage to your eye. Make sure that your fabrics is usually like the denim type. Those are the best. Dark or bright colors are typically the best. A very lightweight long sleeve shirt will work. For more effective protection, you want to select clothing that have ultraviolet protection, or SPF on the label. Make sure that you apply a broad spectrum sunscreen. So what is a broad spectrum sunscreen? It's a sunscreen that contains a protection against UVA rays and UVB rays, because a lot of sunscreens only protect you against UVB rays, but not the UVA rays. Yes, they may protect you against a sunburn, but they don't protect you from the UVA rays. So those are typically the chemical sunscreens. So unless it says broad spectrum, it's not protecting you 100%, or it's not protecting you against both rays. To be on the safe side, a mineral sunscreen, meaning zinc-based or titanium dioxide-based sunscreen, which are typically the white ones, are the best. Those are always broad spectrum. Some of them have a combination of mineral sunscreen and chemical sunscreens. So the mineral sunscreens have been proven to be safe. They are true sunblocks. They last typically longer than the chemical sunscreen. And why is that? Because the way the chemical sunscreens work is by binding to the UV radiation. And once they bind to the rays, then there is a chemical transformation that happens, and then within an hour of sun exposure, you have no chemical sunscreen left on your skin, unfortunately. So the best advice is, if you're going to be outdoors, especially at a beach, just get a mineral sunscreen. It will protect you much better. A lot of them are water-resistant sunscreens. There is no such a thing as a waterproof sunscreen, but they are water-resistant sunscreen. Most of them will be between 40 and 80 minutes. You have to still remember, when you go in the ocean or in the water and you come out, you know, you are having fun. It's just very hard to remember, but you need to reapply your sunscreen. And then what about the SPF? We recommend an SPF of at least 30 or even higher. But if you are looking at a sunscreen that has an SPF of 100, and it's probably not a mineral sunscreen. Sunscreens, mineral sunscreens are not usually 100 SPF, but they're enough and probably even better than choosing a chemical sunscreen that is 100 SPF. So what if you have at home a sunscreen that says 70 SPF, okay? It's a chemical sunscreen, most likely. And you apply it and you start rubbing it onto your skin because you want it to get absorbed. What you're doing is actually you're rubbing it off. And instead of applying an SPF of 70, you're applying 7 because you're actually rubbing it off. So the best way to apply your sunscreen is to get about a shot glass worth of sunscreen, and that's good for all your exposed areas of your body. You want to apply it thick and just one layer and let it be. That will get absorbed, do not worry, instead of rubbing it. And then apply it on another area, buy it, and leave it. And you continue to apply that way until you have covered all your areas. If you don't want to do that, there are certain sunscreens that are spray or they are like or mist, and they're easy. The spray sunscreens are much easier to apply, especially in kids who are moving around. Just be careful it doesn't go on their eyes or on their faces, but you can use those too. There are mineral sunscreens that are sprays as well. They're not true air sprays, but they're pretty good. The only problem with the mineral sunscreens that are spray is a practical thing that they get clogged. And so many times you end up having to just open the cap and just applying them with your fingers. However you do it, make sure all the areas of your skin are protected, or that you apply the sunscreen on all the areas of your exposed skin. If you cannot do that, then cover them. There are beautiful hats with white brims, and a lot of them will protect the back of your neck, especially for men who like fishing. Also, you need to remember to reapply your sunscreen every 2 hours when you are outdoors. After swimming, even if it hasn't been 2 hours, or sweating, if you're sweating a lot. Don't forget your feet. This is very common. When wearing sandals, flip-flops, or going barefoot, please apply your sunscreen to all exposed skin. As I mentioned before, there are physical sunscreens and there are chemical sunscreens. The sunscreens that are chemical, as I said, they actually work as a sponge. What it means is that they absorb the UV radiation. There is a chemical reaction that happens, and then they disappear. The common names that you're gonna find under chemical sunscreens are the benzones, so the oxybenzone, avobenzone, octisalate, and all the other ones that you can see on that screen. It is much easier sometimes. They are a little bit cheaper as well. The physical sunscreen, on the other hand, they do work like a shield, and they deflect your sunscreens, their rays. That's why you have to apply thick. You don't want to apply very thin, and you're going to rub it off if you keep rubbing it, trying to make it absorb. They will not absorb that much on the skin, but that's how they work. Now, these are the best to use if you have a sensitive skin, or if you have rosacea, for example. Do not use chemical sunscreens on your face. They tend to also induce dermatitis, the chemical sunscreens. They induce burning in your eyes when you apply it on your face, especially if you use the sprays. Also, you need to keep in mind that there are physical sunscreens that may be a little bit more expensive, not a whole lot, and that you can use on your face, and they're liquidy. So yes, it's becoming more popular nowadays. There are many different brands. I'm not going to mention them here, but you can find them online, and they feel really like lotions. They are great. They don't produce acne. They are great for rosacea patients, basically people who have a very sensitive skin of the face, people who get a lot of flushing and redness and veins on their faces. Those typically are people with rosacea. They are basically the best sunscreens that you can use if you have some type of photosensitive sensitivity, meaning if you are on medications like high blood pressure medication like thiazides that make you really sun sensitive, or if you are on antibiotics that make you sun sensitive as well. So that is that in terms of sunscreens, and I will, of course, I will answer questions on sunscreens if you have them later. But I wanted to also mention something extremely important during the summertime, especially when you have kids. So as you know, kids, if you're going camping or you're going to the beach, you don't want mosquito bites, you're going to be applying DEET. Well, the problem with DEET and sunscreen is that DEET will make your sunscreen completely inoperant, so completely ineffective. So you don't want to put them together. The sunscreens that contain mosquito repellent are completely out of the question. They do not work, okay, because the DEET will inactivate the sunscreen. And if it's not DEET, it's not going to work very well either. So one of the things that you want to do, because you have to reapply your sunscreen, but you don't want to reapply your DEET all the time, because you can, especially in kids, you can produce intoxication, especially the younger ones. What you will do is you will put your sunscreen on first. You're gonna put your DEET. I would prefer, the best advice is to either use a lower percentage DEET, like a 7% or a 10%, no more than that. Or what works the best, spray your clothing. Spray all your clothing and whatever you're gonna have around you, but don't spray your skin with DEET, so not to inactivate your sunscreen. You still need to reapply your sunscreen much more often if you have DEET on your skin. So that is a good question about mosquito repellents. And you can use other forms of mosquito repellent that are, like the lamps, and like I mentioned before, maybe spraying the tent or around you. I'm gonna move on. We are very close to the end, and then we're gonna take some questions. There is a common myth. I mentioned before that a good base tan will protect me from sunburns and sun damage. But if you do that, you're basically injuring your skin already. There is no such thing as a healthy tan. That's something to remember. As early as adolescents, we're starting to notice with certain special lamps the sun damage that even kids have. And no wonder when they become older, like the women on the right side, their skin becomes so wrinkly and the skin becomes so dark, right? So that is something to remember. And this is the end of my slides, and I will take questions. I'm going to stop. I'm going to stop sharing my screen.
Thank you so much, Dr. Yes, we can hear you. So now we will give our participants a few moments to write any questions and comments in the questions menu. It's one of the gray bars that you'll see on your GoToWebinar control panel. While participants are entering their questions, we'll go over some contact information and upcoming events. So remember, today, celebrate with us National Dawn Friday. National Dawn Friday is the National Council on Skin Cancer Prevention has designated the Friday before Memorial Day as Dawn Friday to raise awareness on skin cancer prevention and to encourage everyone to protect their skin as they head outdoors to kick off the summer season. During the entire month of May, the Samaritan Cancer Resource Center has been celebrated on Friday. Our aim is to help raise awareness about sun safety and to remind everyone to protect the skin you are in when enjoying outdoors. If you haven't yet stop by the Cancer Resource Center to get free sunscreen and information about the importance of skin cancer prevention. This is the contact information for the Cancer Resource Center. Now we are also available on social media. So here you can see our Facebook and Instagram channels, or sites. And remember to contact us to subscribe to our Cancer Resource Center newsletter. This coming month of June, we're gonna be celebrating cancer survivors. So stay tuned to all the resources and events we're gonna be having, and they'll be coming up. We're gonna have Surviving with Pride, perspective for LGBTQ cancer survivors. We're gonna have another webinar, Cancer and Sexual Health 101, as well as Exercising as a Cancer Survivor. And there's a surprise for all survivors, cancer survivors, during this month at the Cancer Resource Center. And so now let's go with our questions. So let's see. Do most dermatologists offer preventative skin exams, or is that done by primary care?
What a great question. Absolutely fantastic question. So most dermatologists will actually offer a preventive skin exam. I cannot tell you how many patients I have that come just for a yearly. For some people, especially my melanoma patients, will come either every 3 months or every 6 months for a preventative skin exam. I look at them from head to toe. I look at their scalp. The scalp is a very difficult location to see for anybody. I look in between their toes. I do not look at their genitals unless they do ask me for it. Usually, if they do want me to check, I will check. Otherwise, most of the times it will be their OBGYN or their primary care. But most men will actually ask me to. I have to say that primary care physicians are not trained for a skin exam. I know it sounds odd because they do rotate, a lot of them rotate through dermatology, but not all of them. They don't necessarily, they're not trained enough to catch an early melanoma. They're not trained enough to catch an early skin cancer. They can actually refer a patient who, if they are auscultating their backs and they see a weird looking mole, but they don't, many times, and most of the times, they don't have the ability to differentiate between a skin cancer, like say a melanoma, from say an age spot. And many times they will biopsy an age spot and it's not necessary. So there is not enough training. The American Academy of Dermatology suggests or advises that people, especially people who are who have had any kind of cancer, such as breast cancer, such as or are on immunosuppressants, people who have had a lot of sun damage, a lot of sun exposure, work outside, outdoors, people who have been working like roofers, to go and see a dermatologist once a year. A lot of insurances will cover. I've never had any problems with that. And it's definitely advisable that your best skin exam will be done by a dermatologist. We do use a dermoscope, which is kind of like the stethoscope that cardiologists use. Primary care physicians are not trained in that. They don't necessarily use one. They may use a magnifying glass, but it's not the same thing. So also they're not trained enough in how to perform the appropriate biopsy for a melanoma. And like I said before, because there isn't enough training for a primary care physician, they can do the basic skin exam. But if there are any concerns, they should be seen by a dermatologist.
The next question is 2 in 1. Are red moles related to melanoma? And what about skin tags?
Excellent question. Thank you very much for asking that. It depends on what you call red moles. So melanomas can be red, but most red moles are not melanomas. There are pink moles that are very, very common. They tend to be soft and pudgy, that are not melanomas. They may grow in size, especially when they are becoming older. They become fatty, so they become pudgier. That's not a change that tells me it's a melanoma. And then there are red bumps that are very, very, very red, almost like blood red. And those are blood vessel growths. They never turn into melanomas or any other skin cancer. They are very, very safe. They are genetically passed on. So you basically inherit that predisposition. And as you grow older, you get multiple of those, typically on the trunk. They can also appear on the face, on the scalp. And typically you will have more than one. So those are very benign. And then we have skin tags. The skin tags, we're talking about a little bump, skin color in most cases, but they could be dark also. And they have like a neck. They have a neck and they kind of flop like this when you move them with a finger. They never turn into cancer either. They are benign. They're just cosmetic nuisances. Sometimes they get kind of like, tagged by the clothing. They're fine. They're also genetic. So they like to come on areas of flexure, such as the neck, areas under the, in the armpits, where you have a lot of friction, under the breast, in the groin area. Those are typical locations for tags, and they are benign.
Next question, what do you think about spray tanning and spray tanning booths? How safe are these?
Excellent question again. Spray tanning is deemed to be safe as long as you don't expose to the sun within 24, 48 hours. Otherwise, we don't know exactly if it does cause and induces any kind of, if it makes you more sensitive to the sun or not. That's the big question. But in general, it's safe. You can do spray tanning all the time, and the spray tanning booths. Having said that, I will say a little bit about the older ladies, like myself, who have a bunch of the little dark spots. If you have age spots, which are darker than your skin color, when you do spray tanning, they may become darker. So I'm not sure, you might want to just try first before you go for spray tanning if you have a lot of those age spots or those sun spots that have high pigment, just to make sure that those spots don't become darker. That's all.
Thank you so much. Our next question is about sunscreen. Do you have to apply sunscreen on your armpits or the soles of your feet? And what about the eyelids and the ears?
Excellent question again. For your eyelids, you want to use sunglasses. If you can't, because you're going to be in the water, you can apply a sunscreen on your eyelids. Just make sure that it's a mineral sunscreen so you don't damage your eyes. The soles don't need to be don't need to have sunscreens. It's not an area of sun exposure. Same with the armpits, unless you're going to be, laying in the sun just like that. In that case, yes, you need to cover with sunscreen. Only the areas that will be exposed to the sun. I do want to also emphasize that your lips, the skin of your lips is very different than the other skin. It does not contain as many melanocytes, pigment, as the rest of your skin. So you do want to lather your lips with a good mineral sunscreen. You don't want to put the chemical sunscreen, but yes, a mineral sunscreen, like a zinc. So in the old days, we used to use zinc, which was the white one, to cover the nose and the lips. And that's a great practice. Nowadays, we have better zinc products or better mineral sunscreens that you can easily use on your lips and your nose, or the rest of your face, and even on the eyes. And there are some mineral sunscreens that are tinted, meaning they have a tint, they have a little color. It's a safe sunscreen. It contains a third sunscreen, even though it's not listed as a sunscreen, but it's called iron oxide in the tinted sunscreen that actually protects you from the visible light. And what that does, it protects you from producing increased coloration of increased pigment of your sunspots. So it's great for people who have a lot of sunspots to use a tinted sunscreen, or people who are of darker coloration. It's a great sunscreen, so you won't look white, but you do want to cover definitely your lips as well.
Great, thank you. There's a question, it's more about ecology, but I don't know, you may know. It asks about the if the minerals sunscreens are safe for coral reefs.
Correct. You are totally correct. They are safe. And when you go to places like Mexico or other places where like you're gonna go Caribbean, they're gonna be very strict about the type of sunscreen you use. They don't want any preservatives in the water. They don't want any chemicals in the water, and they're right. So the zinc-based and titanium-based sunscreens, and even iron oxide that I just mentioned, they are all safe for the marine fauna and flora, and so they have not been proven to be to affect anything.
Fantastic, this is great, thank you. And then I think this would be our last question. Does expired sunscreen still protect you? Expired.
What? I'm sorry?
Expired sunscreen?
Expired. No. As I mentioned before, all sunscreens have an expiration date. They're different than the moisturizers. The sunscreens do have an expiration date, so you need to read it on the bottle, and if it's expired, you need to ditch it. I wanted, just since I mentioned the moisturizer, I wanted to mention one more important thing, especially for the ladies. We ladies like to use a lot of moisturizers, and a lot of moisturizers contain sunscreen and great sunscreens. But the problem is you're in a moisturizer will protect you all day. So we are in the moisturizer with sunscreen. Careful, you need to reapply your sunscreen. Don't necessarily reapply your moisturizer, but you prefer to put a sunscreen on, then your moisturizer, then you can put your makeup on. And nobody has asked me that question, but I believe it's a very important question. What's the layering? If you do apply a medication, a prescription medication on your face, you will apply your medication first, your prescription medication, then your sunscreen, if you apply your medication in the morning. So prescription first, sunscreen then moisturizer, and then makeup.
This is good to know. Thank you so much, Dr. Brune. We've learned a lot with you. There's no more questions, just a lot of thank yous and a grateful audience. We have learned a lot. So now, if anybody has a question that you would like to ask Dr. Brune privately, email it to us, and we'll send it to her. First, I'd like to remind you that after the webinar, you'll see a survey pop up. Please fill in the survey after the webinar has concluded. It'll help us a lot. And thanks to our speaker, Dr. Brune, for sharing your time and knowledge with us. It's been really, really instructive. Thank you so much. And finally, thanks to all for participating today. And you may now disconnect and have a great day. Thank you, everybody.
For the opportunity. Thank you for the opportunity to serve. It's been my pleasure.
It's been
Happy great Friday.
Happy Friday and happy Memorial Day weekend, everybody. Remember, don't Friday. Bye.
Bye-bye.